PCSI has a parent version, an above 12, and then a 5 to 12. And so we use that, like you described, also because they developed theirs, probably within the last, I would say 7 to 10 years is when they developed PCSI. So a little bit younger, more recent than PCSS or some of the other symptom scales. They saw some of the limitations of, expecting everyone to say that they were a 0 before. And so anything after was from the concussion, which, we all know is probably not true. So they developed this whole concept of having a pre-injury, rating. Now, that said, I think that a lot of folks would say that you could just use, the PCSS and other symptom scales and just ask them, in a standardized fashion, how they were before, and then do a comparison. And there have been some studies that have been published looking at that. And so I think you would fully be well within your rights to be using PCSS and then just asking it in a retrospective manner, asking what were your symptoms before this injury. PCSS obviously is valid for those older teenage and adult age ranges. And so I think that would be totally fine. But that is why we like PCSI, because it has both of those, and it does go from 5 all the way up through into adulthood.